Pets Life, managed by vets, loved by pets. Introducing our 50% off cat neutering program. Get your cat neutered for half price. This limited time offer is perfect if you want to get your cat neutered this year. Valid until the end of 2024. Book now on petslife.ie.
TFI Local Link, your local bus service, keeping rural communities in Kildare connected as part of the Transport for Ireland network. For more on service arrangements, visit transportforireland.ie.
The 11 to 3 with John Dunn.
Your music and more. Kildare's KFM.
It's a Pet's Life with Gym Dog, Ireland's first pet resort by Des the Vet. Managed by vets, loved by pets. Daycare, vet care, premium pet food and grooming. Visit at petslife.ie.
Okay, very good morning to you. First of all, let's get in touch with us by texting or WhatsApp your questions regarding your animals. 0833 97 97 97. We'd love to hear from you. General questions as well. So if there is a problem, an issue, or behavioural, or illness, or something to do with rashes, or whatever the case may be, send in your questions now and we'll get to Des. First of all, I better say hi to the man himself. How you doing, Des?
Yeah, good, John. Nice to be here. Thanks.
Yeah, okay. So, I was just curious. We always pick a topic every week. Why did you pick neutering this week?
Because our promotional campaign for the cat neutering is ongoing till the end of the year.
Yeah.
And we're going to do one for dogs for the first quarter of 2025.
Right.
So I want to put it in people's heads if they have a young male dog and they want to discuss the options and the pros and cons of whether they should neuter their young male dog or not, they can ring us because we're going to have a discount scheme in place, 30 to 50% discounts for the first quarter of 2025 to promote and encourage dog neutering.
Okay, so let's go back to the very basics. I was just thinking, let's go back to... We always use the word neutering. Everybody says, it's basically the snip, whether it's male or female.
Snip,
What does neutering actually prevent and what does it do?
The two reasons we do it is birth control, which primarily is from the female dimension. And the second reason is behavioural modification or improvement.
Right.
That's primarily the male side.
That's not something we've discussed before when it comes to neutering. We're always just thinking it's neutering to stop them having pups, and that's basically it. Yeah,
we'll stop the females from having pups. So that's the spay side of it. Removal of the ovaries. They don't ovulate. They don't come into heat. They won't get pregnant. So that's the convenience side of things. If you own a female dog, you don't have to worry about unwanted litters. Same goes for cats. Now, on the male side, you're neutering because it drops their testosterone levels. And that has a desirable improving effect on their behaviour. It reduces aggression, reactivity, reduces spraying, roaming, fighting, general reactivity, general behaviours that are associated with aggression or microaggression or reactivity in the male dogs.
Okay, here's a quick question for you regarding, because it just popped up straight in front of me. Jean was on, she says, I was over in Canada and subsequently I was in Switzerland over the last 2 years or so. I heard of dog vasectomies. What are dog vasectomies? I presume they're the same thing. But they wouldn't be that popular,
same thing.
Would they?
Wouldn't be that popular.
What's the difference between a vasectomy is just blocking off
vasectomy, you cut the epididymis so that the passage of sperm wouldn't be possible. And blocking the passage of sperm means that male dog is not fertile, so he can't create unwanted pups.
Yes, okay. And that would be generally done if they're purebreds or you're stopping breeding temporarily or you want to reverse.
Pedigree dogs might want them to look a particular way for showing.
Yes.
Or you might have a competitive sporting dog or working dog, and you want him to keep his musculature and athleticism that comes with the testosterone.
Yeah.
And then you might have a vasectomy done rather than a full neutering.
Yeah, I never heard
because
of it.
a full neutering is castration, which is removal of both the testicles.
Yes, and that is the common thing for both animals.
Yeah, so a dog that has a vasectomy will still have testosterone.
Yes.
A dog that's properly neutered, castrated, he has no testosterone.
Right.
So his dominance behaviours, aggressive tendencies or microaggressive tendencies, they're all decreased, and you'll have less roaming. You won't have marking of the territory, urine marking. You won't have reactivity or acting out to the same extent with other male dogs.
Okay.
So that's a desirable behaviour modification which makes male animals more manageable and therefore safer.
Okay, so but look, I just saw the question coming in, so I posed it to you. I wouldn't be considered that you wouldn't be doing a hell of a lot of vasectomies.
I can't remember the last time I did a vasectomy. I might have only done a couple ever in my career.
Okay, right,
Yeah.
fair enough. Okay, so let's go back to the nitty gritty of it. So we're talking about basically for males it's castration, for females it's spaying.
Yeah, there's two ways you can spay a female: removal of both ovaries and the uterus,
Yeah.
and the womb. And when you do that, you reduce the risks of various other cancers. The other way of doing it is just to remove the ovaries and leave the uterus in place.
Yeah.
It doesn't make too much difference which way you do.
Yeah.
We prefer to do an ovarian hysterectomy this side of the water. That's the convention that all of Irish and probably English vets are educated with, which is to remove the ovaries and the uterus.
As dog owners, why are we considering neutering?
To reduce the inconvenience of the female dog coming into heat twice a year for 2 weeks.
Okay.
And it is a considerable hygiene and sanitary inconvenience to have a female dog come into heat, because
Right.
she'll come into heat for 2 weeks, she'll bleed for a week to 10 days,
Yeah.
and therefore that creates cleaning issues in the house.
Right.
That's the first thing. Secondly, it does limit where you can bring her, how you can socialise her, how you can mix her for that 2 week period, because you can't expose her to male dogs.
Yeah.
They will behave aggressively and in a difficult way towards you and your female dog when you're out and about.
And the other thing is, I was just thinking of, I mean, you do a doggy daycare, and you know your own place where the dogs go along, or whatever the case may be, into gym dog. I mean, do you dogs have a habit of causing havoc if they're not actually neutered, don't
yeah.
they? So
Yeah.
how do you manage that?
Okay, so we're not proscriptive about it. We don't insist on them being neutered.
Right.
They can come into us if they're not, because we've a few acres, we've a big enough place. We have the place divided up into paddocks of different sizes, and we have rooms of different sizes, and we mix them according to age appropriate and size appropriate groups. Now, smaller places that are just doing doggy daycare and don't have the vet hospital or don't have everything there, they might have to insist on a dog coming in neutered, because they might need to mix them all into one room. If we have a male dog, he's not neutered yet, we would still like to socialise him, give him the opportunity to play, express his natural instincts, learn to mix, learn to behave with other dogs and other people, and we wouldn't impose limits on him as to when and necessarily if he would be neutered. Now, what happens after a while is 18 months of age to 2 years of age, right? The ones who have too much dominance in them, maybe too much of a working dog instinct, we often do have to go back to the owners and say, it's time now to have Buddy neutered.
Yeah. Okay.
We're having difficulty with them.
Okay,
so
that makes sense.
some of the males come right and are civilised and are gentlemanly and never really need to be neutered. But others do have too much of a working dog instinct, and we have to ask the owners to get it done.
Okay, Bernadette was on. She wants to know, when it comes to neutering your female, as in spaying,
Yes.
What age, and do you wait till they come into heat once or twice, or is this a myth, or do we just get it done after a few months?
Yeah, that's a great direction to bring the conversation in, because it's an important point, and there's been modern research on this, and the thinking around spaying or neutering the females has changed a little. It used to be that vets were doing it at 6 to 7 months of age, and the reason why is because it's an easier operation the younger you do it, and you get less complications immediately during the surgery.
Okay.
But yeah, here's the thing. All the modern research is that you should leave them until they've had their adolescence and they're fully mature.
Right.
So there are findings now that if you spay them too young, they will gain weight quicker.
Okay.
And they'll develop joint disease because their growth plates are not fully closed before adolescence.
Okay, that's a brilliant tip. I mean, so you're talking about, okay, for the first time the dog is born, they usually go into heat, after 6 to 8, 9 months?
Yeah, between 6 and 9 months, these females are having their first heat, and it's just right on the cusp of adolescence.
Yeah.
They're just purely teenagers, and they've had their first heat.
Okay.
Or they're having it.
Or in some cases, their first litter.
No.
Okay, so just clarify that then.
No.
So what you're saying is, you get this spaying done before you have a litter.
Yes, you should.
Right. Okay.
Yeah, you should. You don't need to have a litter.
Okay.
No. So there was it was really typical old vet advice. Go, and there'd be kind of people who would have gotten this advice in the 70s and 80s from older country vets. Let them have their first heat, and even let them have a litter before you're spayed.
Okay.
Now, the thinking behind that was to wait again. It was just about waiting for them to be fully mature before you do it. But now we can pinpoint an age, and we can say to people, it doesn't matter how many times she's been into heat, and you definitely don't need to let her have a litter of pups, but do get her done between 15 and 18 months if she's a large breed, 12 months if she's a smaller breed, maybe leave her 18 months to 24 months if she's a giant breed.
Yeah. Controlling pregnancies as well through spaying also will help further down the road regarding, say, shelters and things like that, and excess dogs.
Yeah, it prevents excess dog numbers. Now, one of the reasons why, for instance, you have there's a culture in the hunting communities and so on, people who breed these lurchers and sighthounds, and the ones that breed the bully types. There's a culture amongst those sort of communities against neutering and spaying.
Okay.
And that is why there's so many of those in the shelters. One of the reasons why there's so many of those in the shelters. There's no population control. Certain breeds of dogs have better population control on them than others, and the ones that aren't properly controlled are the ones that are going to end up in the shelters.
Yeah, and to be honest with you, the shelters are getting better and better and better and better as we learn more about them, and more people are getting volunteering more. And I suppose the shelters that are really good recommendations and the good names, they look after the dogs, some of them for life. I mean, they don't mind them, do they?
Yeah, they mind them very well. Well, they don't want to look after them for life. The idea is to try and turn them over, but they will. They can. They keep them for quite a while. So they're spending money on them. They're getting them vaccinated. They're getting them spayed, getting them neutered, and they're requesting a donation of, I think it's 120 to 150, that sort of money to cover their basic vet care costs before they'll rehome a dog out. So if you go to one of the good shelters to give a dog a home, hopefully 99% it should be spayed already. It should be neutered already. And it'll be vaccinated already as well.
Okay.
And speaking of the shelters, Dogs Trust in Dublin, they have a very good subsidised neuter scheme. So you can apply to Dogs Trust to get a voucher to assist you towards the cost of neutering, and you can bring that voucher into most veterinary practices.
Okay.
And it'll be redeemed.
Okay.
And it'll act as a discount off the cost of the neutering.
Okay, right. So with females, we're talking about let them go through the first process and into adolescence, which is a great tip. Then you think about getting them spayed, and from there on in, everything should be hunky-dory in theory.
Yeah, so the age you spay a small breed, 12 months.
Yeah.
The age you spay a larger, medium to large breed, 18 months. In some cases, you can let the giant breeds stretch it out to almost 2 years old.
Okay, so that's the female. What
side.
about male? People have male dogs.
Yeah, again, let them have adolescence.
Okay.
So that they're fully grown.
Right.
And that they won't put on unnecessary weight afterwards, and they won't develop joint disease.
Okay.
And they'll be fully grown. So, again, for the smaller male dogs, 12 to 15 months. For the larger breeds, medium and larger breeds, 18 to 20 months of age is the ideal age to neuter or castrate a male dog.
Yeah. I mean, look, the other thing is that you always notice is, and sometimes you see people, look, dogs can be very frisky, and I'm using the word frisky, the males particularly.
Yeah.
And after they get the done, the old snip, do they calm down after that?
Yeah, they do. Again, the research on this indicates that castration reduces mounting behaviours.
Yes.
Roaming and wandering behaviours.
Yes.
And urine marking the territory. Those behaviours are reduced by 70% after castration.
Right.
So that
difference.
means if a dog has an old habit of cocking the leg, he still will a little bit, even after he's neutered, but he'll be generally a much cleaner and more manageable dog.
Okay, what about so let's take it to the next stage now. So people have booked in their dogs, whether it's male or female, to get the actual operation done. What does it entail? What's the recovery period, and where do we go from there? Yeah,
so pretty much the same process in every veterinary practice. The vets want them in early in the morning, do little checkups on them, fill in the consent forms, discuss the ins and outs with the owners. So you'll be dropping your dog off 8:30 to 9 and leaving them at the vets, whether it's a male or a female. And your dog will have had its dinner the night before, but no breakfast. They'll always say fasting from the night before. So no food in the stomach the day of the operation.
Yeah.
You drop them there at the vets. First thing the veterinary nurse will do is make friends with your dog and get its weight. And then she'll go through the consent form with you, get you to sign that and discuss the costs.
Yeah.
Then you leave your dog there. It'll have its surgery. Hopefully, usually we try and schedule these routine procedures for the morning. The dog is waking up then for the afternoon and going home early afternoon. after recovering from his general anaesthetic. These surgeries take between 45 minutes and an hour and a half.
Right, depending on the size.
Yep. Exactly. And they're waking up for a couple of hours afterwards. Now, with the females, there can be complications. There can be a little bit of bleeding. There can be a little bit of bruising. It's not a simple procedure. There's more involved in it on the female end of things, because you're opening the abdomen and creating a lot of stitching through the abdominal muscles, and you're removing the ovaries, and you're probably removing the womb as well.
Yeah.
So it's a full internal operation, and there'll be 6 to 8, maybe 10 stitches in the abdomen afterwards, and your female will have a cone on. When you come back to collect her, she'll have a large cone, which is the Elizabethan collar, to stop her from being able to lick at her stitches, lick at the wound. And there will be probably a bag of anti-inflammatory tablets or painkillers for you to give for 4 or 5 days. She'll have had morphine and a painkiller injection and an antibiotic injection in the vets.
Okay.
And as I say, they'll give you painkiller tablets to use for probably about 5 days. And you'll take her home. She might eat for you that evening, or she might not.
Okay.
Put her to bed for the night. Same with the male dog. He'll come out. He'll have a cone on him. He'll have had his castration. He'll have about 3 stitches down near the scrotum.
Yeah.
And that'll be a bit tender and sore. But in the males, the wound is only about 1.5 inches, 2 inches long, whereas in the female, that wound will be 5 to 6 inches.
Okay.
So he'll have about 3 stitches. She'll have probably about 10.
Okay.
He'll have a cone on as well, and he'll have anti-inflammatory or painkiller tablets going home, and he'll be a little bit woozy, a little bit groggy after a general anaesthetic, and you'll put him to bed for the afternoon, for the evening.
Okay.
Put him into his crate. Day 3 or day 4, most vet practices then ask you to come back for a free checkup. That's just to make sure that none of the stitches have been pulled, and that there isn't an abnormal level or too much level of bruising or swelling or pain or soreness around the sutures. So a little check that the wound is okay.
And did they go on an antibiotic or preventive antibiotic as well, or are they okay animal?
If they look a bit sore and inflamed at the 3-day checkup, you might then dispense 3 days antibiotics.
Okay.
But as a general rule, we avoid antibiotics unless we have to give them.
Okay, right, fair enough. Right, Paul King was on. He says, we had a red setter, 2 years old. He's an absolutely fabulous dog now. He was very, very hyper. And John, as you said, frisky was an understatement. He got his operation. He's absolutely been fantastic since a whole new dog. But his appetite seems to have changed a little bit over the last few months or so. He's not as kind of hungry as before, and he goes off his food a little bit. Is this part of this? Would that be a typical?
No, that's unrelated.
Okay.
That's to do with changes in his exercise levels, changes in his routine, changes of his calorie requirements.
Okay.
So some other reason for
Just
that.
some other reason for that. Nothing related whatsoever. Okay. Some general questions coming in, Des, and it's probably mixing across the board with some of the stuff we're talking about. First of all, I have a 6-month-old male kitten. I'm trying to decide whether it's best to neuter him or not. He's only been indoors except for an occasional leash and harness in the garden. Is there any health reason to do the procedure, or is it unnecessary in this case, says Hayley?
Yeah, Hayley, you have to neuter your male kitten. There's no two ways about it.
Yeah.
That's just not even a conversation. It's not even a choice.
Right.
All of the evidence is that sterilisation or neutering of cats is really positive in its effect.
Yeah.
First of all, you have the population control aspect of it. Secondly, for male cats, they are cleaner afterwards.
Yeah.
They don't fight, they don't roam, they don't wander.
I would agree with that.
All of those positives.
Yeah.
You definitely have to neuter your male cat. And believe me, you will want to do it. One of these days, your 6-month-old male cat will begin to mark his territory, as cats do, and suddenly you'll walk into the house or walk into the living room one day and the place will stink and you'll wonder why.
Yeah, and the other thing is, I think they're more aggressive when they're not neutered.
They're more aggressive when they're not neutered. They fight with each other.
Yeah.
And they come back with half an ear and half an eye hanging out.
Right.
And bites and lumps out of them. And then all the different cat viruses that are out there get spread from one cat to another.
Okay, right, fair enough. JB was on. Can you please give advice, reactive behaviour of a 6-month-old Labrador?
reactive behaviour
What is that?
socialised. So reactive behaviour is where it behaves with aggressive fear or fearful aggression,
Okay.
primarily towards other dogs when he meets them. So the form of it is lead aggression. It's a type of territorial or fearful behaviour. They're on a lead, they feel insecure, they feel they have to defend their owners, and they feel they have to defend themselves. Socialisation, lots and lots of mixing. So that's an ideal candidate of a dog to begin daycare,
Okay. Right.
where he gets
Good.
the chance to meet other dogs and people, and his reactivity will then improve.
Okay.
Neutering him straight away won't improve that. You have to do some training, you have to do some socialisation, and then later, before the reactivity turns into aggression, you have to neuter.
Okay. Right, there you go. Straightforward, good advice. Think about that one. Here's another one. Hi, guys. My dog keeps eating poo. I have a 4-month-old German Shepherd, and she is wormed.
Yeah, it's a very bad habit. It's a nasty habit. We talked about it before here,
Yeah.
and we kind of dispelled or busted the myth that it's to do with worms or to do with a deficiency. It's not to do with any type of deficiency or anything to do with parasites. It's just a bad habit they get out of. And the reason why is because the food quality of what we feed our dogs nowadays is so good that when they pass out their stools the other end, unfortunately, it still smells like food. So they'll re-eat it.
Okay, right, fair enough.
You've got to pick up her stools, and you've got to bust the habit by reacting in a really corrective fashion.
Okay.
When she does it. So you must correct her, you must help her understand and learn that it's a bad thing, make her fearful of being caught doing it.
Okay, right.
Yeah.
Yeah.
And pick up the stools.
Right, okay. Okay, there you go. Great bit of advice from Des as well. Peter's on. Morning, guys. How much to get skin tag off my dog?
Skin tag, sounds like that listener is asking about the cost of a minor little surgical procedure, maybe.
Okay, I
to
didn't
get a
get
tag
yeah,
off.
yeah.
Like that wouldn't be. That's 100 to 200 euros maybe.
Okay.
But the vets will ask you, do you want it sent to the lab to check that it's not cancerous? And the vets might have an opinion as to whether it could be cancerous.
They'll advise you
or
either way.
not.
Yeah.
Yes. But getting a small skin tag removed is not an expensive operation.
Right, okay, fair enough. Keep your questions coming, and don't worry if you don't have, because what we will do is we will pass them on to Des next week if there's an overspill. And here's another couple of questions after coming in really quickly. I have a 6-month-old female. She is big, but I was told she has OCD in her right knee.
Yeah.
Could it be better if she had an operation on this to help her with her activity, says Elizabeth?
Yeah, OCD is a type of arthritic condition. It's
Okay.
a form of osteoarthritis that juvenile dogs or growing dogs still get. I would say she's too young for surgery.
Okay.
You need to go through the process of having all of the nutritional and mineral management tools put in place first. So, am I right in saying that she mentioned that this dog is only 6 months?
Hold on, I'm not just logging back to a different source. Hold on, just bear with me for 1 second. I have a 6-month-old female.
Yeah,
She is
that's what I thought
6-month-old
she
female.
said.
Yeah.
Okay, look, that's very young to make a definitive diagnosis.
Okay.
There's a work in progress there. I think you need to work with the vet that made the diagnosis, and you need to reassess it over time. And during the next 6 to 9 months, what you need to be doing is putting in place a better type of nutrition, a nutritional program, nutritional feeding plan based on improving her cartilage development, her bone development, making sure she doesn't grow too quickly, making sure she doesn't get too heavy, and enhancing the health and strength and conditioning of her joints until she's about 15 months of age. And then have follow-up x-rays done and see what the joints look like at this stage. But that's a developmental type of arthritis. So it's a work in progress. It'll change as she matures.
Okay.
And it'll either get better or worse.
Okay, brilliant. Another one. Here's one. A stray cat. How do you know if she is spayed or not? Or is there a blood test that she has had to do? She's had no kittens at all. This is from Christine in Maynooth, a regular listener to KFM.
Yeah, there is a blood test you can do, check for progesterone levels. And an easier way sometimes is to ask the vets to clip up her side and see if there any sign of a scar.
Right, okay.
That she might have, where she might have been done previously.
Okay, and finally, last question. Is 3 too old to neuter a Cocker Spaniel?
No, it's a good time to do it because you'll still get the benefit of reducing the risk of cancer if you do it.
Okay.
So the there are a few cancers that unneutered females are more prone to get. You have adenocarcinomas of the mammary glands.
Yeah.
And a condition called pyometra. So neutering, even at 3 years of age, greatly improves her overall health and the likelihood of her not getting these diseases as she gets older.
Good stuff. That's the way to wrap up. I was really busy today for some really strange reasons. Great topic and subject, John, as always. And we'll podcast this a little bit later. Thanks, Des.
It's a pet's life with Gym Dog, Ireland's first pet resort by Des the Vet. Managed by vets, loved by pets. Daycare, vet care, premium pet food and grooming. Visit at petslife.ie.